Zombie apocalypse.
Hello viewers, welcome to my channel Medicine Radar. Myself Moyuk, and today we are going to start the pharmacology of diuretics. So what is diuretics? Diuretics are the drugs which increase the rate of urine formation. As we all know that kidney is the filtration unit of our body. Okay, and in case of kidney, the functional and structural unit of kidney is nephron. So in case of purification of blood or filtration of blood, the nephron plays an important role. By nephron, all the blood in our body is filtrated and the waste products are getting out from our body and the useful products remain in the blood. So this is the filtration process by which the urine is formed. In your normal physiology, you have also read about that facts. What are the formation of urine and what are the process of formation of urine. But in case of diuretics, these are the drugs or medications which are mainly used to increase the rate of urine formation. So why it is needed? In case of different type of disorders, mainly hypertension, heart failure, nephrotic syndrome, cirrhosis, these type of disorders need a greater amount of electrolytes should be getting out from our body. And this will help to cure this type of disorders, mainly hypertension, heart failure, nephrotic syndrome and cirrhosis. So in case of the depletion or excretion of electrolytes from our body, urine is the main source. So by urine, all the electrolytes from our body are getting out from our body. So you have to increase the formation of urine. So these type of drugs are mainly used to increase the formation of urine. So these are mainly called as diuretics. What are the classification of diuretics? Okay. Mainly, at first, by discussing the classification, we have to know an important fact, that is increase the urine volume and loss of electrolytes. We all know that our body fluid is full of different type of electrolytes, mainly calcium, potassium, sodium, magnesium, etc. etc. So in case of depletion of body fluid from our body, the electrolytes must be depleted from our body by that body fluid. So urine is the mixture of different type of electrolytes, different type of essential products and also the water. So in case of diuretics, they not only increase the excretion of urine or the fluid, but also they can excrete a larger amount of electrolytes from our body. Okay. So what are the classifications? Mainly they are classified as thiazide diuretics. Examples are chlorothiazide, hydrochlorothiazide, high saline or loop diuretics, mainly furosemide or ethacrynic acid. In some books, it also written as furosemide. So furosemide and furosemide, both are very important and both are same. The next one is K+ or potassium sparing diuretics. They are spironolactone, amiloride, etc. The next one is carbonic anhydrase inhibitors. They are mainly acetazolamide. And the last one is, the fifth one is osmotic diuretics. They are mannitol, urea, isosorbide. So these are the 5 most important classes of diuretics. So these are the classifications or the examples of that particular classifications. Okay. So we have to discuss both or all of them one by one in our next part. After starting the diuretic portion, you have to know about a detailed structure of nephron. So, because the practical or the most important site of action of diuretics is nephron. So, the diuretics are playing their important role in different parts of nephron. So, nephrons, different parts are mainly glomerulus, Bowman's capsule, proximal convoluted tubule, thin descending limb, thin ascending limb. They are the 2 parts of loop of Henle, and thick ascending limb, distal convoluted tubule, collecting tubule. These are the main parts of nephron. So in case of studying the diuretics, you have to know that diuretics are playing their role or affecting the particular parts of that nephron. So the increment in the urine formation is going out. Okay. So these are the definition and classification of diuretics. So we have to come in the classification of different type of diuretics. So the first one is thiazide diuretics. Okay, at first, before starting the classification, I have to tell that in case of different type of disease formation, mainly the disease which can inflame our body or create some edema, in case of cardiac, in case of renal, or in case of pulmonary, different type of disorder, or in case of liver, there must be some accumulation of different type of electrolytes and fluid in our body. So we have to deplete this type of extra electrolytes and fluid from our body to get rid of this type of disorders. So in which cases, this type of diuretics are playing their major role. Okay, so in case of thiazide diuretics, this was first introduced in 1958 as in the name of chlorothiazide. Okay, so chlorothiazide is the first invented thiazide diuretic. How it works? What are the mechanism of action of thiazide diuretics? Means it blocks the sodium and chloride or Na plus Cl minus O transporter in distal convoluted tubule. Okay, in the nephron, I had also told it earlier that in case of diuretics, their main site of action is the nephron. So the nephron contains different type of parts. One of the most important part is distal convoluted tubule. It is very important. In case of thiazide diuretics, these thiazide diuretics are mainly playing in that particular part. So in the distal convoluted tubule, it blocks the sodium and chloride co-transporter. Co-transporter, symporter and porters are the doors or the windows by which the ions are going in and out from a particular place or in and out from the cells. These are called as co-transporter or symporter. Okay. So by blocking the Na plus and Cl minus co-transporter, it also blocks the reabsorption of sodium, chloride and H2O. In case of nephron, reabsorption is a very important process by which some essential products get back to the blood and the unused products are going out from the body. So this reabsorption process is very important for the decrement of the volume of urine. Okay, so if we block that reabsorption process, the excess or extra amount of urine or electrolytes getting out from our body. So this will also create an increase in the urine formation. So it blocks the reabsorption of sodium, chloride and H2O, water, and it also increases the potassium loss and also decreases the calcium loss. So this is the way by which the thiazide diuretics are used to increase the urine volume formation. What are the therapeutic uses? Long-term hypertension, edema in congestive heart failure, cirrhosis, premenstrual tension. This type of diuretics are used. In case of NDI, means nephrotic diabetic insipidus, stone formation means kidney stone formation, hypercalciuria, this type of facts or this type of disorders in which the thiazide diuretics are mainly used. Acute glomerulonephritis and CRF means chronic renal failure. In those cases also these thiazide diuretics are also used to increase the urine volume formation and to increase the efficiency of the kidney or nephron. Okay, so the next part is high saline or loop diuretics. High saline means highest efficacy. So this type of diuretics have the highest efficacy or highest action rate. Okay, what are the mechanism of action? It blocks the sodium, calcium and chloride symporter. Okay, in the thick ascending loop. Thick ascending loop is present in Henle loop. So this type of diuretics are mainly working in the loop or loop of Henle. So this type of diuretics are mainly called as loop diuretics. So they are blocking the sodium, potassium and chloride symporter, and by blocking that symporter it also blocks the reabsorption of particular electrolytes and also the water, and thus it increases the potassium and chloride loss. So by which or by this process, this high saline or loop diuretics are used to increase the urine volume formation. What are the therapeutic uses? Mainly edema in cardiac, renal or liver origin. Mainly edema means the inflammation or accumulation of some fluid. So in case of accumulation of that extra fluid, you have to use the diuretics to deplete out this type of extra fluids. In case of APE and hypertension, it also used. APE means acute pulmonary edema. So these type of disorders are mainly need that particular high saline or loop diuretics. So the number 3 is carbonic anhydrase inhibitors. Carbonic anhydrase is an enzyme. Okay. So this enzyme is present in proximal convoluted tubule cells. The main function of this enzyme is it is used in the reaction of carbon dioxide and water to form the carbonic acid. Okay. And for the catalyzation or for the dehydration of carbonic acid, this enzyme is also used. The carbonic acid is dehydrated in the presence of carbonic anhydrase into H plus ions and bicarbonate ions. These bicarbonate ions are reabsorbed in a normal process of urine formation. But when we need to increase the urine volume, we have to use the acetazolamide. These are the carbonic anhydrase inhibitors, one part of diuretics. Okay, this acetazolamide is used to inhibit that carbonic anhydrase. By inhibiting that carbonic anhydrase, it will also inhibit the reabsorption of this bicarbonate ion. Okay, so by inhibiting the reabsorption of this bicarbonate ion, it also inhibits the reabsorption of sodium ions. So this sodium ion and this bicarbonate ion are excreting out from the body by the urine. So the urine volume is increased. So this is the main function of carbonic anhydrase inhibitors. Okay, so what are the uses? They are very rare to use because they are very weak acting. So their use is nowadays very limited. They are also used in acute open angle glaucoma. Glaucoma is a disorder in which the fluid accumulation is generates into your eyes. So accumulation of fluid generation in the eyes, this is called glaucoma, and in this case of glaucoma, this type of carbonic anhydrase inhibitors are also used. In case of urine alkalization, in case of acute mountain sickness, adjuvant therapy in epilepsy, these type of diuretics are also used. So these are the main function of carbonic anhydrase inhibitors. The number 4 is potassium sparing diuretics. Potassium sparing means this is a particular diuretic which is used to inhibit the excretion of potassium ions. So they are called as potassium sparing diuretics. They inhibiting the potassium ion excretion. Okay, they mainly act on the collecting ducts and tubules or collecting tubules and inhibits the sodium reabsorption. So the sodium ions are excreted in larger amount from the body by the urine, but they can retain the potassium ions. This is the main part. So by the retention of the potassium ions and excretion of sodium ions, they are exhibiting the diuresis. So in this case, because of that potassium ion is retained into our body, so there will be no potassium supplement is needed after that diuretic therapy. So this is called as potassium sparing diuretics. The next part is osmotic diuretics. What are osmotic diuretics? These diuretics are mainly responsible for the water diuresis. They are not affecting the excretion of electrolytes. They are mainly affecting the excretion of the water. So they cause only the H2O diuresis by working on PCT, means proximal convoluted tubule, and loop of Henle. There is no reabsorption takes place. So there will be no reabsorption of the electrolytes takes place. So there only the excretion of that water takes place. So they are called as osmotic diuretics. All examples I have told earlier in the classifications. So these are all about the pharmacology of diuretics. In case of different type of disorders, mainly cardiac disorders, liver disorders, different type of respiratory disorders, inflammatory disorders, and as well as different type of kidney disorders. These type of diuretics are the main treatment of choice. Okay, and in case of hypertension, different antihypertensive drugs are used in the combination of this type of diuretics, mainly thiazide diuretics. So this diuretic portion is an important part of medical science. Okay, and this is an important part also in case of pharmacology. So this is all about pharmacology of diuresis. So I hope you have enjoyed that all session, and please go to the description of that video for my notes, and please subscribe, share, comment, and like my channel. Please give your valuable comments that will encourage me to do this type of videos in future. And also, please subscribe my channel, and see you at next time. Thank you.